Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon and Gynaecologist, practicing here at Vriksh Fertility, HSR Layout and Whitefield, Bengaluru. Wondering if your IUI cycle works in your first try? You're not alone in guessing for this. The answer is actually quite more encouraging than you would think. Today, let's discuss about this. Now, understand that the success rate of IUI is about 10 to 25% for every woman. This depends on several factors like your age, your underlying causes, etc. So, let's break it down today. Age. If the woman's age is less than 33 years of age, then the chances in IUI in your first success could be about 15 to 25% per cycle. Whereas, if the age of the woman is more than 33 years of age, then the success rate drops down to about 10% per cycle. This is because as a woman's age increases, the quality of the egg comes down. Number 2. Underlying causes. If there are any underlying causes during your IUI treatment cycle, like having severe male factor infertility, having PCOD, endometriosis, etc., or some general medical health conditions like uncontrolled diabetes, thyroid, hypothyroidism or hyperthyroidism conditions, or even if your prolactin levels are very high or your hemoglobin levels are low, that is if you have been diagnosed with anemia, all these conditions definitely affect your chances of conceiving. Now, remember that IUI procedure can be successful for many in first attempt itself, but for few it may take about 2 to 3 attempts. This also depends on several factors. One of the most key factors is how healthy your tubes are. Yes, the fallopian tube is very crucial because IUI procedure is nothing but placing good healthy sperms inside your uterus. You may say that but my tubes are open. Yes, tubes open doesn't mean that they are functional. We still do not know how the functionality of the tubes are. So, do not get disheartened if it doesn't work in the first try. Sometimes the egg and sperm may not meet, the egg quality during that cycle may not be great, or the sperm might not have gone and met and the resulting embryo might not have been healthy. Or maybe the embryo which has come back has not implanted. Several causes are there for IUI failures. So, what do? Just relax, breathe and try again. Now, how do you improve your success rate? Number 1, by tracking your follicle, timing your ovulation and timing your IUI accordingly. So, do not skip your visits to your doctor, do not skip your medications, do not skip your timing. Do not skip to be at the proper time for your IUI procedure. Number 2, take your medications properly, your supplements, especially whichever are being advised to you like Myo-inositol, vitamin D, CoQ10, etc. These all are also important to optimize your success rate. Number 3, optimizing the sperm quality. Instructions which are given by your fertility doctor to increase your chances of conception for the sperm parameters should be followed. That is to take any supplements if any, avoid toxic chemicals exposures and too much of heat exposure, etc. And maintain the optimal abstinence period also which your doctor advises. Number 3, minimize your stress. Both the partners should be stress free and trust the process. Age and fertility are definitely linked closely. But how does your chances of IUI get affected by your fertility? Today, let's discuss about this. IUI success rate by age. What does the numbers say? So, first age group under 30 years of age. Success rate is about 20% per cycle. Why? Because you are younger, the quality of eggs is better. There is regular ovulation which happens and the chances of fertility outcomes are better. Your body's response to fertility medication is also better. Age bracket of 30 to 33 years of age. Here, the success rate is about 15 to 20% per cycle. Your fertility is still stronger if there is no underlying medical condition. This is an ideal age group for IUI with minimal stimulation. Now, age group of 35 to 37 years of age. Your success rate is ideally around 10 to 15%. Fertility starts to decline here and thereby egg quality also starts to decline. IUI may still work very well if it done right with proper medication under the right doctor's guidance. Now, age about 38 to 40. Here, the success rate is about 8 to 12% per cycle. Your egg reserve and your egg quality may drop drastically and the egg quality may not be that great. So, usually we try IUI for not more than 2 to 3 cycles. And we advise them to move to IVF if this 2 to 3 cycles of IUI fail for better fertility outcome. Now, next, age more than 40 years or about 40 years, the chances of conceiving via an IUI cycle is about 5% or less per cycle. This is because the egg quality, the egg quantity and the fertilization potential are drastically reduced. IUI may still be tried in some cycles in some centers for certain specific women. This selection criteria for 40 plus women whom we try IUI is very, very important. It's not a one shoe fits all size type of a procedure. Now, you also have to understand that apart from age, there are several other conditions which have to be taken into consideration before we advise and tell about the success rate, like your egg quality, your AMH, your sperm quality and your uterine health. Along with these, also your underlying health conditions. All these together contribute to the success rate, not just your age. Hope this helps.